Hello, everybody. Hope everyone's having a good day. Just kind of to get right into it, for question one, I am responding to scenario number two. And so, to ensure that the parents of this child are getting the right amount of education about the lack of effectiveness of antibiotics against viral upper respiratory infections. First, I would just ensure that they understand all of the elements of the Ask Me Three questions from the lecture. So, what is the main problem? Is that we have a viral upper respiratory infection rather than a bacterial. Um, what do I need to know, or what do I need to do about this? Um, and that would be to refrain from giving their child antibiotics rather than, or excuse me, and instead provide supportive care like you would with any common cold, rest, hydration, and then potentially some antiviral medications if it's early enough in that disease process. And then why is it important for me to do this is if this child were to take antibiotics and didn't need them, they could decrease their normal flora, normal bacterial flora, and end up with a more serious bacterial infection like C. diff. Secondly, I would use patient-friendly pain language. So instead of saying like upper respiratory infection, I would maybe say like cold that the child has. And then I would evaluate their learning using the teach back method. So have them explain to me what they're going to be doing and why it is important that they do that. And then for question two, I chose to respond to prompt one, and I got this from the Kirwan Institute article, Being an Active Bystander. And I chose the strategy using I statements and direct communication. And I came up with a little response that kind of goes like this. I think that the comment you just made is generalizing this patient based on a group of people she belongs to rather than providing the best care and resources we can for this patient. I don't think that it is fair to do to this patient, and I think it is. I think an attitude like that directed towards this patient can negatively impact the care she receives. And I thought that this was a good strategy to prevent this behavior because being direct about a situation like this is, in my opinion, the best way to limit this behavior and limit its effects on the patient. Thank you.